The first lesson in anatomy is the planes of the body, followed by the parts of the cell as a review from biology, and then the body cavities. And the planes of the body really are going to be used throughout the rest of the course, so it's very important that you get a very secure knowledge of those. And what I've got on the screen is the most common three planes, the sagittal, transverse, and coronal. And they're pretty easy to remember with a few tricks. The coronal plane is also known as the frontal plane. And I like to tell students it would be most often used with getting a facelift or a medical examiner looking at the facial bones, looking for breaks. We had a vice principal a few years ago, Leland Brennan, who had so many sinus infections that his sinus cavities had actually been completely blocked. And so they needed to remove the skin of his face and pull it down and then re-drill the sinus cavities. And that's really what a facelift often is that a coronal cut is made and the skin is then pulled down and then cut and tightened. So the coronal cut is, or also known as the frontal, is if I'm taking a saw and I am sawing that piece this way. And then again, facelift being one of the more common reasons that in the facial area that the sagittal cut would be done, or the frontal. And please get used to flipping both names, because you'll hear, depending on your Gray's anatomy professor or your college professor or your colleagues, you'll see both terms used interchangeably. I like to use the saw when I demonstrate, but obviously they would be using scalpels or another form of a laser scalpel, etc. Our next plane is probably the one that you will use most often in medicine, whether you're a physical therapist, an occupational therapist, if you're a nurse or an LPN physician. The sagittal plane is often called the midline or the mid-sagittal plane. And please pay attention to the spelling on sagittal because there are two T's. So that sagittal plane, or the midline, is directly sawing the body in half. And why I say it's the most common term that you will see in medicine is because oftentimes after a patient has had a brain trauma or a stroke, they are looking, physical therapist or the nurse or the other healthcare provider are looking to see if the person can hold what is called the midline. So if I was to stand up and I had a stroke, I often would tip to one side or the other and not even be aware that that was happening, because the brain with the injury that it's had doesn't recognize. And what happens with the patient, whether it's a young child who's had a brain trauma or whether it's an older person who's had a stroke, is the brain doesn't even recognize that the person is not standing straight. And then as they try to take a step forward, they tip over. So oftentimes, especially if you are going to be becoming an LNA, you will learn how to use a special lifting belt. So the belt goes around the patient at their waist and it has a nice gripping piece in the back. And so when the patient gets up, you are trying to help them get to that midline or nice and straight. Oftentimes in physical therapy rooms, you will see that there are mirrors so that the patient can start trying to get their brain to realize what is that midline or that sagittal component to it. And again, that is one of the indicators of that brain damage. And again, using my saw, the sagittal would be this way, and I would try to go right for my nose and right straight through. So in medicine, as far as surgery is concerned, that sagittal cut is done for virtually all abdominal surgeries that need to be rather extensive. Oftentimes, if there's a great deal of time they have, it's a planned surgery, they are able to make a smaller incision. I'm thinking especially for a C-section. If it's a well-planned C-section, they can make a very small cut, a transverse, which you'll learn next. And then once that cut is done, they will go up sagittally under the skin and go into the uterus that way. So the sagittal plane, if we're having to do abdominal surgery from the navel up, and if you were having to open up the chest cavity for cardiac surgery, you were looking for the sternum, or the end of where the breastbone was. In medicine, we call it sternum. And they're going to be doing a sagittal cut up with a chest saw. And then the chest would be retracted open from that sagittal plane. The next is your transverse plane, and I like to say that that's sawing the person in half. If you ever watched that magical show when you were a young child, or even recently, where they take that saw and they start just sawing the person right through their abdomen. And of course, it's not real in the magic show. The transverse cut is done in medicine. Most oftenly, the first one that comes to mind would be if you are donating a kidney, then a transverse cut is done on the person's body to remove the kidney. If you're receiving the kidney, generally it's just added in. It's more of an abdominal cavity surgery, where even though a kidney may not be fully functioning, a poorly functioning kidney is better than a kidney that is an issue, where if they opened up the person's back with a transverse cut, there is a higher risk of infection because it's a larger wound, and the person is already not doing well because their kidney is not fully functioning. So again, our coronal cut, where it's going to go this way, often used to remove the front of the skin and then be returned. You have your sagittal, or your midline or median, and then the transverse that goes across. Those are your first three biggies. In the next slide, I will show, get to our next slide. I should have one additional slide. Here I've shown you an example of where I do a mini lab where we make little people, whether an apple or through pickle or a marshmallow, and then practice the planes of the body. And to do that, you would be taking spaghetti or toothpicks, whatever is available, and tagging those so that I can see that you have learned those. Here we have the coronal, or cutting that again. And in this case, I can't think immediately of a cranial surgery that they would do on purpose that way. The cranium actually has its own midline, but this is a coronal cut. Here, again, that sagittal, midline, or median cut. And although I could have stood little Mr. Apple person up, the easiest way to show this is laying down. And again, this would be the first incision used for a relaxed, easygoing C-section, where this would be called what is notoriously known as the bikini cut. It is so low down through the integumentary of the skin that the average bikini doesn't even show it. And then they would do a sagittal cut. The oblique is one we haven't talked about yet. The oblique sections is not often talked about in anatomy classes because it is rarer. So all of the other cuts that I've shown, or the planes, the coronal, the transverse, the sagittal, those would all have function in an MRI or a CAT scan, etc. The obliques, though, are not something that those imaging systems can readily show you. So an oblique would be like an angle cut through a kidney to be able to give you a look at what's going on, or the depth, or how tough the kidney is. And this is sort of a review of our biggies, and here also shows you part of the problem with anatomy, and that depending on what school you go to, depending on what country you are from, they will have different terms for the exact same thing. And it is my job to show you or tell you all of the jobs, and to tell you that I will choose, if you put one of these down on a test, I will accept any one of them. This is when generally students will ask, which one do you want us to use? And I don't have a preference, because I know that you will be hearing, depending on the textbook, there'll be several of these different for the exact same term. I gave the example to that several years ago, and Dr. Joseph Minicello, a former student of ours who was completing his third year residency in medical school right now, he went to Dartmouth, and I had warned him when he took anatomy with me that oftentimes you will hear the exact same word or the exact same term in one professor, and then the next professor over teaching another anatomy class will use a different term, and to just know what that professor wants. And one of the examples I had given was after we finished this overview of the review of cells in the anatomical cavities and planes, we go into the skeletal system, the integumentary system. And I had warned him that some professors are very strong feeling in that the largest organ of the body is the skin, and others feel it is the internal organ, the liver. And he told me after his first year at Dartmouth that he had two professors, one that said integumentary system or your skin was the largest organ, and the professor directly next door said it is the liver. And he listened to my warning, and he put down whatever they wanted on their exam. So again, this is showing if we had the skeleton up in the room and we could go through it and do the coronal cut or the frontal plane, and then sawing the person in half would be your transverse plane. It's also called the horizontal axis. Your sagittal, which again is what I consider to be the one you will use most frequently. And it is also what we consider to be a longitudinal plane. It's very, very long. And then continuing this, because it's such a large piece of the human body, they will also call this one piece section a median plane, dead in the middle of the leg, for example, and the parasagittal plane if it is going through just an exterior portion, the shoulder, etc. So if they're having to do rotator cuff surgery, for example, parasagittal plane. And having said that, I have never done surgery on a rotator cuff, so I'm just guessing that it's parasagittal. If we have a parent out there, a guardian who's a physician and is a surgeon and is more familiar with this, they may say she's incorrect. It is not a parasagittal, but just know that's just one easy example for me to give you, that it is an incision that would go on not throughout the entire body midline, but through just one section of the body. For example, this is a parasagittal, and over here would also be. For example, if I'm removing some fat from a section of the anterior thigh versus the interior of the thigh, and I'm going the length of the interior of the thigh, that would be a median plane cut that I was doing. And that, thank you, is the end of our initial instruction on the planes of the body. Thank you.